Hi everybody, my name is Andy and I am a nurse with and this is the fourth video in a series of weekly medical educational videos. This is an optional video, but I would like to know your thoughts. I will try to keep this to 10 minutes and please give me ideas for future topics. Today's topic is going to be understanding the basics of diabetes type 2. So first of all, everyone has probably heard of diabetes, but in this video we are specifically talking about diabetes mellitus type 2. This differs from diabetes mellitus type 1 and diabetes insipidus. Just so we know, diabetes type 1, in its very basic definition, is the inability for the body to produce enough insulin to utilize the sugar that we consume for energy. It is often known as juvenile diabetes because it often starts in childhood and is often considered to be an autoimmune disorder where the body inappropriately attacks the beta cells in the pancreas that produce insulin. We can get into this another time, but I will touch on it a little bit in this video. Diabetes insipidus is a totally different disorder that most of us won't ever deal with, but I'll mention it because it is also a type of diabetes, but unlike diabetes type 2, diabetes insipidus doesn't involve the imbalance of blood sugar and insulin, but rather is a fluid imbalance disorder that generally involves an imbalance of a hormone known as vasopressin, which is also known as the antidiuretic hormone, ADH, which can cause a mass amount of fluid loss through urination. In this video, we're going to dive into the disease that is the fastest increasing chronic disease in the United States, and that is diabetes mellitus type 2. Most people in the United States and other first world countries are very familiar with this disease. Just so we know the numbers, in 1958, there were less than 1% of Americans with diabetes type 2, and by 1997, that number was up to 3%. And by the year 2021, that number was up to 11.6%, or 1 out of every 9 Americans. In other words, in 1958, there were about 1 in every 100 people in the United States, and now it's 1 in 9 people have diabetes in the United States. Also, so we know people's bodies and genetics do not change that much, so we know there's something environmentally different that is causing this increase. Like many ideas, there are many ideas, but we also must remember that very few things have just one single cause. Lifestyles and diets have changed more in the past 70 years in first world countries than they have in the past 500 years. I'm not going to get into my opinions of why this increase has happened, would rather like to talk about what is going on at the cellular level and see what you think. Even the medical science community is at conflict about the causes and the ways to change these numbers. At the rate that we are going, estimates are that by the year 2050, only 25 years away, that around 25% of Americans will be diabetic. That is 1 in every 4 people. Why is this so important? Well, diabetes increases the risk of heart disease, coronary artery disease, stroke. It also increases neuropathies and loss of feelings in the extremities, which can lead to amputations and infections and vision loss. It also increases kidney disease, gum disease. It also has relationship to depression and even many cancers. So in order to understand how diabetes type 2 is a disease state, we must first understand how the processing of sugar in the blood happens with a more healthy individual in a non-diabetic state. I made a little diagram here. I hope you can see it all right. But in the non-diabetic state, we consume carbohydrates and sugars, which are a primary source of energy, and it is absorbed into this bloodstream here. Our body receptors sense that we have these carbohydrates, sugar, and glucose in our bodies, and they send a signal to the pancreas to secrete insulin. Insulin comes into the bloodstream, and it works like a key on a cell membrane in a human body. This is the cell here. In order for the body to use carbohydrates, sugar, glucose that we consume, it has to be able to get into the cell to be converted into usable energy known as ATP. Sugars cannot cross the cell membrane unless they have a door to get inside and the key, that is insulin, to be able to open up that door. So in this picture, we can see that insulin in the blood opens up that door to allow glucose in so that it can be used for energy in the body. And just to touch on type 1 diabetes so we have a comparison. In type 1 diabetes mellitus, the body is not producing enough insulin due to a problem with the pancreas generally. If there's low insulin in that bloodstream, if you do not get insulin in that bloodstream, we build up blood sugar, and we must get insulin from an outside source like an injection or an insulin pump. Now, when we talk about diabetes type 2, we have an individual that consumes carbohydrates, sugar, glucose, and secretes insulin normally. But for some reason, it's not opening that door to the cell, or there is a problem with the machinery inside of the cell that's converting glucose into usable energy, ATP. I'm not going to get into this long process of how glucose in the cell converts into ATP, but it can only convert in the cell. But it is a bulky process of some 32 steps that could be and there could be a problem at any one of those steps. But if the machine gets jammed up, then glucose gets held up, just like a car in an assembly line. If there's a problem connecting a part to a car in an assembly line, then the cars coming to the station get backed up and just hang out until there's more help that comes along or the problem gets resolved. This is the same thing with blood sugar. If there's a problem along the way, blood glucose or blood sugars get backed up and just hang out in the bloodstream. And then the sugar in the bloodstream is not good. It can, it just can do lots of damage to kidneys and eyes and cause neuropathies. That is why diabetics have to do a few things to help. One thing that they can do is they can limit the amount of sugars and carbohydrates that they consume, therefore decrease the amount of their blood sugars, which unfortunately reduces their energy levels. They can also take insulin, which is bringing more keys to the cell membrane to open up doors so that we're hopefully able to convert sugar into more usable energy. A common drug that is used in diabetes type 2 is called metformin. In our livers, we have extra stores of glucose. It works like a warehouse. They are often being broken down for energy when we need it. What metformin does is it prevents those extra stores in our liver of glucose from being broken down to usable energy when we need it. So therefore, we only rely on the food that we eat for energy. So there are many theories on why this is happening and what is going on in our lifestyles to cause such an increase of type 2 diabetes mellitus. I will stay away from my opinions on this video, but may discuss reasons in future videos. Most importantly, we have to try to prevent diabetes and try to treat it properly because it does not lead to good ends. Please, if you have any questions, please let me know and I will try to help. I will also try to help managers with better solutions for treating diabetes and working with diabetics. I thank you for watching my video.